Okay, great. So welcome to the American Academy of Emergency Medicine Women in Emergency Medicine section webinar series. I see a lot of familiar faces. For those of you who don't know me, I'm Danielle Goodrich. I am the section chair for the Women in Emergency Medicine section, and I'll be moderating tonight's session. The session will be recorded and uploaded to the AAEM website in about a week. And today is meant to be interactive, so please use Q&A function if you want to ask a question or raise your hand. We welcome, encourage all to participate. There'll be lots of opportunities to participate, and we'd really love to hear from you about your interests or questions you might have. And if you want, you can come on screen when you're asking a question. And if you'd like, let us know where you're coming in from today, and maybe share with us on the chat, something fun that you've done this summer. Okay, so we'll get started. Today I have the privilege to introduce our speaker, Dr. Joelle Borhart. She received her medical degree from the University of Iowa, and she then completed her emergency medicine residency training in Georgetown Washington Hospital Center in Washington, D.C., where she worked as an assistant program director and is now associate program director. She's a former AAEM open mic winner and has been featured on MRAP and has been named Speaker of the Year 3 times by Georgetown residents. And she is the past co-chair of AAEM Scientific Assemblies. Dr. Borhart, thank you for joining us tonight.
Oh, thank you so much. And thank you everyone for making time to meet with us tonight. I'm hoping that tonight will serve as a kickoff and call to action as we come together and develop plans that we can advance and advocate for women's health within AAEM and within emergency medicine. And I think it's often best here to start with why. And why is because women's health issues, I feel, are underrepresented, not just in our training, but I think within our specialty as a whole. Think of how much that we talk about cardiac arrest and chest pain and stroke. And while these certainly are important topics for an emergency physician, I don't have a code every shift. I don't have a stroke alert every shift. But I certainly see an OBGYN complaint every single shift, almost every single shift for nearly 15 years. And I don't think that that's reflected in the amount of time that we spend on women's health issues in our training and in the specialty as a whole. And this is reflected in some of our literature. I can find only one clinical policy on anything really OBGYN related, and that's through ACEP. They do have a clinical policy on the management of patients presenting in early pregnancy, but that's it. There's no clinical policies regarding contraception or management of miscarriage or even management of non-pregnant vaginal bleeding. And this is especially an important issue, as everyone I'm sure on this call is aware and following closely. Our political landscape is changing every single day. I am a native Iowan, as Danielle mentioned. I went to medical school, college, high school, everything in Iowa, have been following the state of Iowa's politics very closely, and they're trying to institute a 6 week abortion ban in the state of Iowa. And so these changes are happening all the time. And so this feels more important than ever that we come together as an organization and as a group to advocate for these issues. I was very pleased to see, the women in EM section and AAEM making a statement on the Supreme Court decision overturning Roe in Dobbs versus Jackson. And I'd love to see more of these. And these are the kind of publications that I think it would be wonderful if our group could be putting out on a regular basis. We are starting to see more OBGYN and women's health related articles. Recently, there was this great article advocating for emergency physicians placing long-acting contraceptions like Nexplanon, and then also a great article in Annals talking about one department's plan, multidisciplinary approach for contraceptive prescribing in the emergency department. So we are starting to see some articles like this, and I think it would be wonderful to see more. So what I hope comes from this webinar and from this group is the development of a women's health interest group as a subsection of the Women in Emergency Medicine section. Some things that I would like to see this interest group tackle are addressing some clinical policies. such as a clinical policy on contraceptive prescribing in the department, miscarriage management, even non-pregnant vaginal bleeding. I think it would be great to see regular articles in Common Sense. I've been seeing more, which is fantastic, but a regular feature would be wonderful. I'd love to see, current and frequent statements on new state laws as things are constantly changing, and speaking out about the restriction of reproductive health in the United States. And especially timely, working together to make sure that there is content, women's health content represented at Scientific Assembly, either through pre-con workshops, such as a papaya workshop to practice manual uterine aspiration, or even an Nexplanon implant pre-conference and other talks. And I know we're coming right up on the deadline. They actually extended the deadline for Scientific Assembly proposals until tomorrow. So if anyone has any ideas, I would really encourage you to submit those. So these topics are regularly represented at SA each year. As far as interest groups, this is what I looked through when I went through the bylaws. Interest groups, we need to have a minimum of 10 members from the academy. Basically, once we have 10 members, we can, apply to the board to see if they will approve this interest group, and then we can take it from there. And just as an example, this is what I pulled up as the simulation interest group. They have a statement about who they are. They have some objectives, and then some common sense articles introducing their group and what they're trying to accomplish as a team. And so that is really what I would like to do now, is open it up to discussion, hear from everyone on this call. Is this something that would interest you? Is this something that you would like to, dedicate some time to, as formation of this interest group, and then, tackling some of these action items that I thought of, but I would love to hear other ideas or other things that you're doing at your shops that you think could be adopted, kind of AAEM wide or nationally. So I guess we'll start with, would there be interest for an interest group of this type from the people on this call?
Feel free to post in the chat or raise your hand. Come off screen, raise your hand, whatever works for you. I'll start. I know I'm interested. Looks like there are some people in the chat who are interested, either making it a separate interest group or kind of weaving it into the women in EM section, which may not have the same, certainly doesn't have the same like participant numbers if we can't find 10 people at this moment to create the interest group.
Yeah, I think we could. And, I think as far as, next steps, what would be, great to hear from everyone that expressed interest is, we could start to put together just kind of a rough, proposal with an overarching objective, for the interest group, and, some of our, near-term action items, and, some of maybe our longer-term aspirational goals. But is there, a particular issue that the group on this call would like to focus on, or sees as a priority, if we are able to form this group?
There are so many, but I think that the abortion access issue is just so important right now that that makes the most sense to focus on. And I don't know if it's worthwhile to start as maybe like a work group or a subsection of women, and then as like interest in, numbers grow, it could grow into its own interest group. I guess it would depend on the numbers to start.
And with the approaching deadline of SA proposals, I know at the last essay there were a couple of talks that were really well received. There was the plenary talk about the kind of legal implications and what the emergency physician would face. Are there any other ideas for proposals that you would like to see, or other special topics, or do you think that's worth addressing again in a different way, or because there's time to pull something together to get that submitted before tomorrow. And I'm happy to do that if there's something that the group thinks would be especially important for the SA community to hear.
I think those topics from the last essay were great. But in terms of like other topics to think about, I think as the community ER docs might be helpful to have like bread and butter talks. We talked about like a working or a statement on contraception, but maybe just a really basic, contraception lecture that talks about, what is safe to prescribe, for whom, for what. And perhaps that could be combined with, you mentioned like maybe an IUD workshop, maybe a little lecture first and then learning how to put in IUDs. Just thinking about things that I would want to brush up on.
What's that?
Seems like
have a hand up or?
Hi, yeah, I did. The topic that interests me is starting contraception in the ED. A lot of women come in and not knowing their options and don't have regular OBGYN care. And I think it's a low-hanging fruit that we can really assist the public with. I come from a public health background and like we're all about contraception when it's wanted. So, and that's a topic that interests me as well as what you're talking about today.
from the chat, there was another person interested in the same, some like services we can offer in the ED, contraception, abortion services, etc. And then there was another comment from our Women in Medicine Section Council member who oversees advocacy. And she said, from an advocacy standpoint, we have the work group, and I feel like our members would be interested in this or already doing it, and we could combine forces. So I agree. Either some sort of advocacy, potentially on a state level or more regional level, might be wherever we can jump in and help, I think.
I'll be honest, I need more education of what we can provide in the ED. I'm applying to residency this year, and I know that throughout my experiences, and we haven't touched on that topic much. And honestly, I know there's only a few resources that you can like point out to. So maybe starting a resource list of some sort for people to refer to later would be wonderful as well.
Yeah, that's a great idea. Because I think some of the barriers when I talk to my colleagues, for example, about initiating contraception from the ED and many of these OBGYN type complaints, they feel overwhelmed. There's so many to pick from. How do you know? And so maybe some sort of simplified recommendations. I think people, if we made it easier for them, hopefully we would get a little more buy-in from some of our colleagues. I know what's also has helped with initiating some things that we're doing in our department, such as offering misoprostol and mifepristone for miscarriage management, was having our OBGYN colleagues come to a faculty meeting and basically giving us their blessing that this is something within our scope. They're totally fine with us initiating these medicines. We don't have to consult them, and so maybe a kind of I don't know if it'd be best practices, but other, kind of tips for, getting some momentum and getting, some buy-in from your colleagues and your department with some of these newer things that people haven't really been doing before in their practice. That's something that really has helped our department.
Question in the chat: is there a way to find out what guidelines are in places for each hospital on abortion contraception guidelines in the ED for medical students?
I guess that probably does vary slightly between the different institutions, I would imagine. And I'll give you an example. So I work here in Washington, DC, and I work clinically at 2 hospitals. I work at Washington Hospital Center, which is has a it's not technically a county hospital, but it has a county feel to it. Very high volume, high acuity. And then I also work at Georgetown University, which is a Jesuit university. And that hospital does have some, restrictions as far as what, patients can be offered for contraception and, certainly abortion services. So, just in my own practice, I encounter some differences, but, I think probably the best place to start would be, your OBGYN colleagues will know exactly what they are and are not allowed to do, or what it is or is not supported by the institution. So that's probably the best place to start for each individual hospital.
And also like checking with your hospital formulary. I know that we have certain like OCPs that are considered formulary and others that are kind of not preferred.
And other things too, like, some of them are on the, $4 list for, Target and Walmart. And, so those are other helpful things that we could, help our colleagues be aware of if they felt that might be a barrier as far as cost. Some of them are really quite, affordable. Other thoughts on, putting together like an official clinical policy proposal? There is a mechanism for that that I was looking through on the AAEM website. There is a committee that reviews, clinical policies. And so I think a clinical policy on probably contraception prescribing from the ED would, as someone said, would be a great one to start, some low-hanging fruit, just to kind of get the ball rolling. And so I don't know if there's, anyone on this call that would want to be, a part of that. We could certainly start there, put some submissions in for scientific assembly. I think those are two, probably top priorities, and work on getting, enough people together so we can, kind of apply for this interest group status. Is everyone who's on the call today okay as being counted as a person who would be interested in joining this group? I think we're pretty darn close if we.
Yeah, I think there's.
And I don't envision, I know everyone is so busy, and everything that you do for AAEM is volunteer, and in addition to your already full-time job. So I certainly don't want this to become too onerous or take over anyone's life. But I think if we are able to get this group up and going, maybe in every other month meeting and check in, just so we can see how we're progressing as far as our action items. I think it would be great too to set aside a time to try to gather in person at the upcoming essay. If many of you are planning on attending that, I think that would be great. There's always a women in EM, section gathering, and maybe we can plan something, as an offshoot of that, to gather in person and, kind of touch base as well. But I think it would be great to, maybe start an email exchange and, see if we can start, kind of dividing up some of these ideas and just kind of getting started and seeing where it goes. I mean, we can start a lot of these things, without necessarily having an official interest group, but we can certainly, begin the process and see if we can build some momentum and attract more people, which I think that we will. Because I know at the last essay, I talked with many of you and many others that expressed interest in pursuing this and raising awareness on women's health issues in general, but certainly those surrounding reproductive health access. So I'm sure there's many more of us out there. And if we can, kind of start the work, I think we'll rapidly attract others to join us.
One idea from the chat was coffee and contraception, which
Yeah.
I think is a great idea.
Oh, great idea. Is everyone planning on attending essay, or usually goes to essay or tries to?
or would like to go?
Or wants to go?
So
Great.
far, oh yeah,
Yeah.
lots of them.
Okay. Awesome. Well, I think one of the proposals that I was going to also submit was for a, potentially either a pre-con or a post-con, course, maybe surrounding, contraception. And so that maybe, there can be a lecture period, followed by something hands-on, either we practice, IUD insertion or Nexplanon insertion. Both of those are very simple skills and, don't take very long at all to learn. And so I'm planning on submitting that proposal. I used to be very involved in the planning of SA. I was the chair for a couple of years. I'm not as involved with that committee anymore, but certainly we'll be putting proposals in. And if there's any other interest in maybe helping or being a co-faculty member on that, let me know. So students, yeah.
We might be able to get a someone to sponsor too, like
Yes.
either one of the IUD companies or Nexplanon. I'm very interested in Nexplanon. And if like a future state could be to do the 2-hour certification at SA.
Yeah. Yeah, learning insertion and removal too. We had someone in our ED just this last week that had their Nexplanon in and they wanted it out, and that befuddled a few of my colleagues, but it's actually quite simple to do, and so we were able to take it out. And I think people are imagining these things to be harder and more complex than they actually are. And so my hope is that with a little bit of education, a little bit of training, people will realize like, oh, I can do this. This is within our scope. This is a safe practice that can really make a difference, especially for our colleagues that are practicing in areas where OBGYNs are leaving. There's going to be harder and harder to get in for, kind of routine appointments like this. And in so many areas, unfortunately. And so I think we can really fill that gap as emergency physicians and are really uniquely suited to do so. So, that's really what I would love to see come out of this group is, the beginning of this new phase where, EM physicians are stepping up and being there for patients when they're living in a restricted area.
Ideally, it would be incorporated into residency training at some point.
Yes, and it needs to be incorporated into residency training. It really does. That's I'm taking over as residency director of our program, and once you take a step back and look at the whole curriculum together, you realize how kind of short shifted many of these topics have always been in our training. And despite how common they are, and despite how many patients present to the ER, with OBGYN related complaints, and the amount of time that's dedicated to the formal training of it it has been lacking, I think, and needs to be more of a priority and more represented, I think, in our curriculum than it is now. And so that's another goal as well, is that, we can make recommendations for residency training and medical school, too. So, physicians are getting this earlier on in their career, so they're ready to provide a lot of these services once they finish training. Any other ideas or anything else that you guys can think of that we haven't mentioned yet that this group could potentially tackle, either in the short term or longer term? Any other aspirations that you all would love to see in your departments or see in your training programs? other ideas or anything we're missing, or any thanks or any other groups that we could collaborate with too, I guess. Or, other either committees or interest groups within, or sections, I guess, within AAEM that would be, good to partner with. I don't know. I know there's a legal committee. I don't know if that, if there'd be enough or any overlap between those two groups, or any other groups that you all can think of that we could partner with on a project.
I think collaboration on a talk with the critical care committee would be great. Just a 1-hour session on talking about OB emergencies and how to treat them in the critical care setting, and doing combined, because a lot of patients are now being boarded in the ED, so it's not like we're not going to see it. So I think joint lecture would be wonderful.
Yeah, great idea. And someone in the comment wants to touch on the future of residency training with, these new laws going into effect. And that is a concern. Certainly, I know it's really affecting the OBGYN specialty. That, the residency applications are down in, states where there are restrictions on reproductive health. Many of them are having to leave their states to obtain this kind of specialty training. I know that in speaking with our OBGYN colleagues here, they've gotten, a surge in applications to do, away rotations, with us, so they can get this experience and get, that training that they need. So it's having a huge impact on that specialty. And I imagine it's affecting the training of EM residencies in areas too, where these restrictions are going into place. So it just, another concern. Well, Daniel, do you know if there's a way to, are all of the email addresses of everyone that was on the call today, are those compiled somewhere? Is there a way that we can, reach out and follow up after this with everybody, or what's the best way to do that?
I think that everybody had to put their emails in order to register, so I could get that list.
Okay.
We can send out a welcome email to everybody who's on this call, and maybe get a Google Doc running of the things that we want to do and certain people who are interested in doing certain things. Okay. And when is the next meeting, the Women in EM section meeting? Is that? Great question. It's August. It's always the first Thursdays of August. And so it's going to be August 3rd at noon. I guess Pacific time, so 3 and 5 p.m. respectively. So I'll send if for anyone interested, there's a lot of people who are in our section already on this call, but I'll send that information out too, so that we can introduce the idea of a working group for now until we get enough members to join to create a formal interest group. Though I think we're pretty close. Okay. All right. Great. Yeah. Then. So I guess, as far as next steps, we can ask, Kathy for the, email addresses of everyone that joined today. And, I can reach out to all of you, and we can start, collaborating over email and, over some forms, start drafting some ideas. I'll plan to do a couple more submissions for essay, and, hopefully we get something accepted. And then, let's plan to, make another call at the call for interest, I guess, at the next Women in EM section meeting, which is actually, that's really close. It's only like a week or two away. So to see if we can get some more people interested, and we can start, maybe splitting up and trying to tackle some of these topics. Absolutely.
All right, well, I think that's all I had, unless anyone else has any other ideas or any comments they want to make. I want to thank you all for taking time tonight to meet with us and hear this. I'm encouraged that there's others out there that are passionate about these same topics and really wanting to push emergency medicine forward in this space to fill that gap for our patients. So I'm really excited and encouraged by this, and I think we can really accomplish a lot.
Thanks everybody for attending, and thank you, Dr. Borhart, for organizing this call to action. I'm excited and to see what the next steps are. And don't forget, everyone, we'll be having some more webinars in the future, so please check the website for those. And then I think hopefully we'll see everybody at the next Women in EM meeting on August 3rd.
Okay, great. Thank you so much. Good night.
Have a good night, everybody.
Thank you. Good night.